Good morning. I'm Dr. Jessica Schorr Saxe. I practiced family medicine for 34 years. Now I'm the chair of Healthcare Justice North Carolina, and I'm a national board member of Physicians for a National Health Program. The reason that I am talking to you today is because every single day I was in practice, I saw patients who didn't get needed care because they couldn't afford it. I saw how they suffered, and this confirmed my belief that people need healthcare. Everyone needs healthcare. I'm particularly pleased to be speaking to this group because I'm impressed with your advocacy agenda, which includes access to affordable care, reproductive choice, equity for women and women's issues, and racial equity and equity for the LGBTQ+ community. Many of your advocacy issues would be addressed by Medicare for All. And I know that you're businesswomen, and I know that many business issues will be addressed as well. I want to start by saying something about the pandemic, because I know it's been on all our minds. If we envision the American healthcare system as a shawl that should be warm and should make us feel secure, the pandemic is like holding that shawl up to the light and seeing that it's full of holes and watching the holes get larger before our eyes. One of the biggest holes is the millions of the people in our country who are uninsured, as well as the millions who are underinsured, which means they have health insurance, but they still can't afford health care. This has obviously had tragic results as people avoid getting needed health care. And others who got it have encouraged large bills. This is not only devastating for individuals and families, but it's bad for the country. Exactly the opposite of what you want in a pandemic. What we want is for sick people to be able to seek care, not only so that they get the treatment they need, but so that they can be identified and their contacts traced, and the disease can be prevented in the rest of us. And that's also true in non-pandemic times. Infectious diseases don't check insurance cards or state or national borders. If your food server or your daycare worker has a cough, you need for them to be diagnosed and treated and not spread the flu or pneumonia or tuberculosis. Another thing that the pandemic has done is lay bare the shortcomings of having a healthcare system based on employment. Just when people most needed healthcare, many lost their jobs and thus lost their health insurance. Many could not replace it. Even those who could had major disruption in their source of care. That's the bad news. So let me talk to you about the good news. We can fix this and do better by improving our Medicare system and extending it to all. I'm going to talk about what Medicare for All would be, how we would pay for it, how it would benefit you, your business, and our country. And I know that you're concerned about displaced workers as I am, and I will tell you how they will be addressed. First, Medicare for All is a financing system. It means there would be one payer for all medical bills. There would still be private doctors' practices and private hospitals, but they would submit their bills to one entity. The payer would be set up by the government, but the government wouldn't run practices and hospitals. In other words, it's not socialized medicine. Having one payer would cut down on bureaucracy. That would not only cut down on expense, but cut down on headaches. It would mean that you, as a patient, wouldn't have to deal with your insurance company because you wouldn't see bills. It would also mean that if you changed jobs, you wouldn't have to deal with a whole new set of forms and formularies and possibly have to change providers because of your new network. And it would cut down on headaches for doctors. In practice, I dealt with endless forms and approvals that were different for different patients. And then if a patient's insurance changed, I either had to get new approvals for their long-time medications or change their medicines to different ones that were on their new formulary. It was endless and draining. As a doctor, I'd rather spend my time seeing patients rather than filling out forms. There were Medicare for All bills in both the House and Senate in the last Congress, and by the time you see this, there may be new bills or they will be coming soon. Both the bills in the last Congress covered everyone in the United States with health insurance and did so without any kind of cost sharing. In other words, no copays, no deductibles, etc. So no one would be deterred from needed care due to expense. We're really talking about improved Medicare for all, not just Medicare for all. And that's part of the improved part, no cost sharing by patients. So the next question is always, how can we possibly afford to do this? First, there are two things I want to tell you to explain how we could afford it. First, everyone knows our current healthcare system is expensive. Not everyone knows how expensive. We spend over $11,000 per person per year on healthcare in this country. That's every man, woman, and child, not just insured people. If you look at other developed countries, they spend about half of what we spend per person. And for that, they not only cover everyone, but they have much better outcomes. For example, they live longer, have fewer babies die, and have fewer mothers die from complications of pregnancy. The second thing to know about how we could afford this is how we're spending our money. We spend about $3 trillion on healthcare per year. And about a third is administrative expenses. That is $1 trillion per year. Again, that's a much higher proportion than other countries. It's estimated that about half of that is wasted, about $500 billion. Well, it turns out that you can do quite a bit with $500 billion, like cover everyone and expand services. And expanding services to include such things as vision and hearing is the other part of improved Medicare for all. The way we would fund it is through some mix of progressive taxes, not all income taxes. There are a variety of ways to do it. People ask whether taxes would increase, and they would by a little, but almost everyone would save much more on insurance premiums and copays than they would pay in taxes. And I want to remind you that we're already paying more than other countries and receiving less. The money is there to support this. In fact, the real affordability question is, how can we not afford to have Medicare for all? You probably wonder what would happen to the employees of private insurance companies whose jobs would no longer be needed. There's provision for funding those transitions with salary support and job retraining in the Medicare for all bills. And because more people would be getting healthcare, there would be more jobs in clinical settings. People could get healthcare jobs actually providing healthcare and helping people. Medicare for all is obviously good for individuals, as everyone would get healthcare. No one would suffer financial devastation as they do now from the cost of illness. And people would be relieved of the anxiety they now have about what they would do if they or a family member got sick. And Medicare for all would address many of your advocacy issues. Reproductive care would be covered and choice preserved. That is explicit in the bills. And everyone, regardless of race or ethnicity or gender preference, would be entitled to health care. Mental health issues would be covered just as physical health issues are. It would also have many advantages for business. This is something you're probably even more familiar with than I am. Businesses now have to devote a lot of energy to evaluating health insurance plans for employees, making decisions about whether to change plans, whether to save money by offering plans with higher deductibles that are hard on their employees, whether to change insurers. Large businesses often have trouble being competitive with those from other countries that don't have to provide health insurance because their governments do. And small businesses struggle with whether they can afford to provide health insurance to their employees at all. Medicare for all would relieve that burden. It would also be good for us as a country because everyone would have health care, because it would cut down on healthcare spending, freeing money up to meet other critical needs. So Medicare for all would be a triple win, at least. Good for our country, good for business, good for individuals and their families. Thank you. I look forward to your questions.